Jai Hind everyone. Welcome back to our third episode of our interaction with Sathvika. Welcome back, Sathvika.
Thank you, Dr. Madhu.
So, as we have already discussed your pre-medical and medical journey of your life period, we would like to know your expectations, future plans, and we will be discussing on same. So, are you ready for that?
Yes, doctor.
Fine. So to start with, we would like to know which medical specialty attracts you most, and what is that which attracts you?
Uh, the medical specialty which I'm attracted to currently is general medicine because after getting exposure to all the different surgery, obs and gynae, pediatrics, and general medicine, I feel general medicine is more like investigating. I mean, once the patient comes, there are wide variety of possibility of diseases the patient can have. It's only after speaking with the patient, examining the patient for after further investigations, only we get to know the clear diagnosis of the patient about what actually the patient is having. Yeah, but most of the times it might be difficult to actually diagnose because the patient usually presents with a varied of symptoms. But I had found medicine is something where you have to be into the patient and actually interact with the patient properly to know what exactly the patient is suffering with. So I find it very thrilling too.
What do you hope or expect for the coming years in your medical life?
In my coming years of medical life, uh, wherever I'll be working and whatever specialty I'll be in, I want to give my 100% best. Even though I do not have the complete knowledge, even though I'm not talented or skilled at performing everything, but whatever I do and whatever I know, I want to do it best. Even though I have limited knowledge and limited things to do, but I want to do it and give it my 100%. Apart from that, I also want to keep myself motivated and not let any other problems or any fight or anything that has happened, anything negative that is happening around me to affect my work life. I want to maintain a proper balance between my personal and my work life. And I also want to take care of myself. Only if I'm okay, I know I can take care of my patients. So,
Very
so giving prioritizing my self goals me is also an important point. And I think I will be able to balance it properly. I hope I will be able to balance it properly.
for sure you should be. What do you think about about people who leave medical profession after graduation? Let's say, for example, becoming a homemaker for girls, or for not necessarily for girls, but for other way also, or joining any apart from medical profession, joining any other stream like becoming a bureaucrat or civil services like this.
I feel normally in India, after completing 4 5 years, I mean, after studying for 4 years and then having 1 year of internship and then dropping out of MBBS, it is a very big thing for society. Even if the person dropping out doesn't is sure about his choice, parents, relatives, society, they instill a thought in the person's mind that it's wrong. The thing you are doing is wrong. You will suffer in the future. You will regret in this future. I mean, I myself remember one of my cousin. He had gotten not in medical profession, but he had gotten a seat in IIT, one of the best IIT after writing the exam. But he chose not to go there. But he chose not to go there, even though he's not doing well enough. But yeah, he's having a good job, good life, good well settled. So yeah, so life was all about choices, and I actually feel the person who's dropping out after having a 4 to 5 years of MBBS is much brave to choose what he wants to actually do in the future. It doesn't matter whether, even if she wants to be a homemaker or he wants to join a civil services, no matter any job for that matter. But everybody should be brave enough to choose what they want and not let the outside voices of the society define them or who they expect him to be.
Okay. So, in future, what kind of doctor do you wish to become in terms of knowledge, skills, personality, ethics? What kind of doctor you wish to become?
Uh, in terms of knowledge, I like reading to a certain extent. So I wish to continue, at least not every day, but at least to keep myself updated with the things going on actually in today's current life. Um, I want myself to do that every day because my even now or even from childhood, that is one thing I have been lagging behind, to know the current affairs, to know the actually what is going on. So I want to be a person who where I'm updated with the current affairs that is actually going on. Apart from that, coming to the personality, I want to be very bold and very practical enough to understand what to do in a situation or how to handle a situation with confidence. So that I know I might make big mistakes, but I just don't want to drop out or leave a situation without even a try. I'll obviously try to give my 100% by asking others, even though I'm not aware. But yeah, I want to try in a best possible way to solve or to clear out my problems in a very mature way that I can.
Fine. In your opinion, for a doctor or as a doctor, what does real success means?
Real success for a doctor, I feel, is the experience at the end of the day where the doctor has, after interacting with multiple patients, uh, I mean, it's the patient's reaction I sometimes feel which can make the doctor happy at the end of the day. I mean, the way the patient responds to him, the even though there might be not all the days will be good, obviously there'll be 1 or 2 days where the things might get difficult, things might get hard, but the success and for a real doctor will be when he's despite of all these things he's giving us 100% no matter what, and he's able to prioritize not only his patients but also his personal life, his family, and his interests that he want to do apart from being a doctor. So I feel if he's able to he or she is able to balance all these things in their life, then that is a real success.
Fine. So, as any other doctor, definitely you might also be having some future plans. So, what is your plan for higher studies, specialization, or research, whether may it be in India or abroad, whatever? What is your plan?
I actually want to go abroad because from childhood I've seen my parents practicing, my mother, my father. I've seen even my cousins for that matter. I've seen they have been doing PG in some of these hospitals. So I have know how the work life will be. I've seen the problems they have encountered or the path. I mean the path how they have to go. So I actually wanted to keep my options open and I wanted to go out of this comfort zone. So that is the reason I want to go abroad and explore more options to see what is actually happening there and how doctor or MBBS life is there different from that of India.
So, do you think the current situation which is going on here in India, like Make in India, Work in India, We India, it's not that moving abroad is something is like anti-national, but yes, what don't you think that since your grassroots are here, you should also be work here for the patients, for the people here in India?
Uh, I don't want to settle in abroad. It's just that I want to complete my higher studies know how things are there, and I'll sure backly come back to India. It's not
Okay.
that I'm going to settle there throughout my life. I don't have any plans of settling in abroad. I just want to complete my higher studies and other part of my medical course in abroad and then come back to India. I will surely come back to India in my
Okay.
future.
So, you feel like you have achieved success in life?
No, I don't think that yet. There are actually many things on my bucket list still I have to complete and I want to do. So I don't think I have achieved success. But yes, I'm proud of myself at the position I'm currently in. But I don't think I'm yet to achieve success in my life. So there are many things I still want to do.
Fine. What message would you like to give to general public who sometimes create trouble or causes harm in hospitals, especially in trauma and emergency department?
Uh, I want the general public to be aware that hospital is an area where not only that patient with whom they're concerned, but there are many other patients too there who are undergoing treatment or who are under care. So there is a level of dignity and respect every hospital has, and the decorum has to be maintained even by the public. There has to be a level of trust and respect that they have to give to the doctors. That what's the point if they don't trust the doctor and they ask the doctor to treat them? Even if the doctor treats the patient completely, then also the family will not be satisfied. So it's the trust they have to keep, and they have to respect the doctors, and there is a line they shouldn't cross, and everybody should be aware of that line. So it's my gen request to everyone and all the public to please have some trust and maintain some dignity and respect towards the doctor, because ultimately everybody goal is to have that patient treated and have him back to normal as soon as possible.
Uh, in same situation or scenario, to continue further, what are your thoughts or expectations from whether may it be government, public, administration on the increasing number of attacks or assaults that doctors are working in trauma and emergency?
uh, I think the hospital administration here plays an important role at the time of assaults. At the time of assault that is mainly happening in trauma and emergency department, as you say, the security, I think, has to be very alert and attentive in keeping the family members outside the trauma and emergency room or the emergency room, so that even the doctor and the patient can be looked at properly to actually identify what's the problem and give him treatment as soon as possible. Because assaulting or creating problem in the hospital is no not advantageous to anyone, neither the patient nor the doctor nor the family members. Everybody there is just creating a ruckus and wasting time. So I feel it's important for the family. I know it's a difficult situation for them to understand, to have some faith and to have some patience and trust the doctor, and the hospital administration should also have to give strict instructions to all the security to keep the family members out of the emergency room until the patient has been stabilized.
Okay. Do you see yourself in more interested in clinical practice or public health or teaching or academics?
I myself personally have interest in clinical practice. I want to I want to interact with patients. I want to know what's there going on. I want to understand what is going, empathize with them or understand what they're actually feeling or what they actually have. But I know that I'm actually very good at explaining things or some giving lectures or something of that sort. So maybe I think I will also go towards academics or teaching profession. But I myself have interest in clinical practice.
Fine. So, what is your idea or thought process on gender discrimination in medical field? You might have heard, like girls usually have a tendency to opt for gynecology, and whenever a boy opts for gynecology, you might have seen that recent movie Dr. G. So like that situation should not occur, or what is your thought process? A boy should opt only and only for general surgery and not for gynecology, or a girl should only opt for gynecology and not for any other subject, like especially ortho? What is your take?
Ideally, a girl can work in an ortho, a girl can work in a general surgery, a male doctor can work in obs and gynae. Like the movie you mentioned, that is also an ideal situation. But when we come to the clinical practice and the things which we see in India, not only the doctor, even the patients too have seen most of them are comfortable with female doctor. They try to choose a female doctor over the male doctor in obs and gynae department. So, and even, I mean, it has been somehow set in the thought process of girls and boys that if you go to ortho department, you cannot sustain or it will be difficult. Yeah, I mean, in majority, and I agree, in majority of the places of India, that is the current situation. And I think, and it'll take a lot of maturity and understanding for both the parties to understand and to bring a change for a girl to opt an ortho department or a general surgery department. But yes, but I feel this shouldn't be the case, and everybody should have the freedom to choose what they want and where to work.
Fine. How do you see the balance between technology and human compassion in future of medicine?
Yes, technology and AI are advancing day by day. Technology has taken the uh, medical advances to a very another level. Robotic surgeries, for that matter, telemedicine, for that matter. These all have made things very much easier and saving a lot of time. But the empathy, human touch, which people say, and the moral values, those can never be provided by any robot, and it is only possible by a human. So
Def-
instead of thinking whether technology is better or a human is better, I think if both of these work together, a lot things actually get easier, making great innovations and making everyday life also very easier. So I think technology should act as an amplifier in helping the human practice or clinical practice and make things much easier.
Fine. How would you like your patients or colleagues to remember you as a doctor?
uh, I am actually usually a funny or a witty person who always remains energized every time. So even in my medical practice, I want to maintain that, and I want my colleagues to remember me someone who's very confident, versatile, bold, and who's also very approachable and open for opinions, open for any debate or opinions that others have. And I'll also like to set a way in which I can empower or inspires them with my journey.
What ethical or moral values or issues in today's medical world affect or concern you the most?
Uh, One such is the day to day, which I have seen the clinical postings which we attend. I mean, all the medical students during the course of their clinical postings, even though we take consent from the patient, we take history, we examination, it is not actually one student. There are 10 to 15 students who's examining the same patient, same wound. same abdomen. And in case if it is painful, or even if the patient tries to say something, we take the consent for granted, neglecting the ethics and the moral values, and continue to examine the patient for our sake, for our learning. And not only that, but even while taking history and examination, I think it is very important to maintain the hospital dignity and the decorum around the patient, and not make him feel like we're making fun of him, or we're not attentive towards him, or we're not empathizing with what he has dealt with. That is one of the very bad thing anybody can make someone feel. So this has not to be done, and patient has to be treated with a great ethics and morals, with a lot of dignity. And for that matter, at the end of the examination, thanking the patient for his patience, for his cooperating with us no matter how many times we have examined, and not getting irritated. Because I have seen there are many patients who usually get irritated throughout the course of our examination or history taking, and then we blame the patient for being angry and not able to give history. And I've also heard many of my friends even say that I'll never join my cousin or someone in the Central Institute because if student keep torturing them like that. So I think that is one of the important place where we have to maintain our ethics and morality and not take them for granted.
What kind of legacy would you like to leave behind in the field of medicine?
Uh, the legacy I would like to leave behind is I would like to work with infinite energy and dedication. I want my patients to feel that they've been heard, understood. I know I cannot satisfy each and every patient. That is highly impossible, but at least majority of them who are under my responsibility, or whoever I treat, I want them to be satisfied, and at least uh, have faith in me that it is eventually going to be okay. And not only my parents, but so not only my patients, but even my colleagues, or that matter for the upcoming doctors who are coming. I want to have my journey as that can at least empower or inspire few of them, so that they themselves can become an inspiration to someone else, or guide them or mentor them in a best possible way.
Fine. Before we wind up, my last question would be, what message would you like to share with the young students or aspirants, medical aspirants, who are joining now or beginning their journey where you had started once?
Okay, so this is for all the students and for all the upcoming new doctors who are going to complete their course, and obviously and will become a doctor and a good doctor one day finally. But just remember that this journey is going to be a roller coaster ride. The 4 5 years present that are there throughout your medical course, try to set goals. Don't hesitate even if you make mistakes, because it's worse than at least not to try. And even after making mistakes, I know it feels bad, but try to accept it and move on. I know everybody says that you have to accept, move on, but nobody actually says how to do it and what to do it. But hold on, eventually you'll get the clarity of thoughts. You'll get to know what is right, what is wrong. You'll get to know how to deal with the situation. And do not forget to speak or ask things when you face any problem. For that matter, anyone, your parents, relatives, family members, cousins, friends, and if none of them is available, at least the medical counseling that is available. Go for counseling in case you face any problem like that. But never feel that you're alone and there's nobody to understand your problems. Throughout your journey, there'll be many problems which you'll face. There'll be many up and downs. There'll be many times where you feel you cannot come back. But don't let your emotional disturbance affect your career or your exams or your personal life. That is what, don't even try, because I have myself seen many of my friends and I myself have experienced this while going on through an emotional breakdown. Not only your physical health, but your social life gets affected, your academic performance drops. This is not at all fair. Even academic wise, you will eventually understand. You have your seniors to guide you, you have your professors to guide you how to go on, what to read, what not to read. But try to be mentally and emotionally strong throughout your journey. Just see that you're not alone. There's always someone to help you, to guide you, and never lose your confidence and never stop believing in yourself. No matter what, how the other person is, how much ever better or talented the other person is, you yourself are complete. You yourself have so many other talents the other person doesn't have. So do not lose trust in yourself, do not lose confidence in yourself, and try to be as much as emotionally and mentally strong as you can throughout the journey.
In true sense, that were very encouraging, motivating words, and indeed, it's very precious for, especially for those medical students or medical aspirants who are going to be your successors. So, with this, let me end this discussion and thank you for being with us and guiding us, our medical aspirants, for opting this future as a profession. Thanks a lot.
Thank you, Dr. Milan, for giving me such a beautiful opportunity. If it was not you, I don't think I would have ever gotten such an opportunity to share what I felt and at least empower the upcoming junior doctors of our today's world. Thank you.
Thank Jay.